Good morning. My name is David Austin. I'm here to present to you Denise Yeager, who's going to give us a very insightful presentation on regarding data, fatalities, and injury. So, by way of introduction for Denise, Denise Yeager is the operation analyst for the Georgia Department of Public Health's Crash Outcome Data Evaluation System, or GOHS project. Denise has worked in injury prevention for over 20 years and has been part of GOHS since 2001. She manages the project and performs several tasks of data management to data analysis. Working on the GOHS project, she uses probabilistic techniques to link crash and other medical injury outcomes data. She is the SHSP task team leader for the risk analysis and evaluation data team. So without further ado, let me welcome Denise Yeager to the podium.
Good morning. I'm going to talk a little bit about fatalities and serious injuries today. And I'm Denise Yeager, and I'm in the Department of Public Health. As David mentioned, I'm part of GOHS, which is the Crash Outcome Data Evaluation system. It uses probabilistic linking that links traffic safety data, such as with the crash data that links with the hospitalization data. And I'm also part of the risk analysis evaluation team, which includes the data owners and also the data users. As you heard maybe a little bit about last year, we have performance measures that are unified both between GDOT and with GOHS. They include the number of fatalities, the rates per 100 million miles, vehicle miles traveled, the number of serious injuries, the rates, and also those are non-motorized fatalities and serious injuries. So we had developed a serious injury thing last year, and so this is what our current goal is, our project, our target goal. So our target goal is 1593. As you can tell from 2012 to 2014, we had a decline. But then in 2015, we had an increase. So that moved up for our target goal in 2018, 1593. Remember that number, and I'll get to it in just a moment. For serious injuries, it also had an increase throughout. And so our target goal is 19,643 for 2018. Now, when we look at our number of fatalities, when we see 2016, those are official numbers from FARS. Our 2017 is actually down to 1549, and we hope that it will stay that way, which actually currently is under our target for 2018. So hopefully we'll actually get decrease instead of increasing as we had. So currently, as of yesterday, we are 22% down from last year at this time. And so this is wonderful news, and we'll continue going to our projected target. Now, there are different types of traffic records data. As I mentioned before, the crash data is currently housed in the DOT. So the DUI Data, citation and license data is in the Department of Driver Services. Vehicle registration is in the Department of Revenue. And then our injury surveillance, which is our medical data, which is housed in our Department of Public Health. That includes the EMS data, trauma data, PD, emergency department, hospital, and our vital records. And I'm going to show how some of the data that we have is incorporated into each of our task teams. So our task teams include the occupant protection, the distracted driving, impaired driving, our serious crash types, which includes the intersection and roadway departure, our age-related issues, which is our younger adult drivers and also our older drivers, our non-motorized users, which are the pedestrians and the cyclists, our vehicle types, which are the motorcyclists, and also the commercial motor vehicle, which are our heavy trucks. For occupant protection, we currently have an observed rate is 9 97.2%, which actually there's a fact sheet that just came out from NHTSA, actually we are the highest in the nation. When you look at all of our crash occupants, our safety data, our safety equipment shows that we are actually 82.5%. But when you look at our fatal occupants, only 46% of them were actually restrained. Our impaired driving, DVS has these wonderful reports actually up on their website is with their aggregate data, and for DUI convictions, they have it for 2013 to 2017. And as you can tell, for the total number of DUIs that were actually processed in the year, and they were actually processed to DDS. In 2017, 22,955 were sent to DDS. Our distracted driving, it is really poorly reported on the crash data. And so this kind of gives us a little bit of an idea of how it's being reported up to being convictions. And so this is by the violation year. And so it has increased up to 2016, and 2017 is down a little bit. And then also on the website, also has it by county. When we look at serious crash types, which includes the intersection, roadway departures, and lane departures, as of this time, by looking at the daily fatality report, they have decreased to 32%, 34%, and 30%. Now we look at age-related drive issues of young adult driving. And as you can tell, this one is by the fatality rate by the driver age by 100,000 valid licensed drivers. And for the younger drivers, they actually have a higher rate than the older drivers, being the highest is for the 18 to 24-year-olds, which is 43.1. Now when you look at the rate per 1,000 crashes, that actually reverses. It's actually the older drivers. They're more likely to be in a fatal crash. When you look at hospitalizations, this is actually where you kind of would come in with the injuries. These are those that actually were either seen or admitted into the hospital, either seen into the emergency department. And when you look at motorcyclists, pedestrians, and bicyclists, you can see their injuries. And as you can tell, we're the middle one, which is the pedestrian, is low. But when you look at fatalities, they are actually increasing. By looking at, it went from 171 to 232, even at that time. And even though that only 1% of either the motorcyclists, pedestrians, or bicyclists are involved in a crash, they represent 11% for motorcycles, 2% for bikes, 50% for pedestrians, for all fatalities. When you look at heavy trucks, looking at the fatalities, they are still increasing for 2016. When you look at the data, they are happening more during the weekday instead of the weekend, the highest being actually on Wednesday, when you look at the data. I hope that I represented a lot of different data sets, different traffic records sets that are available to us that you can even use when looking at just the fatalities or crashes. If you have any questions, you can ask me, or and also here's my contact information.